Good afternoon, everyone. Thank you very much for joining us for today's Thought Leader Roundtable, a conversation on readiness. Today is a part of a regular series of explorations of the key questions of what does it mean for all young people to be ready for life's demands at every stage, and what is it going to take to get there? Karen Pittman, CEO of the Forum for Youth Investment, leads lively and candid conversations every month with some of the most influential boundary-pushing leaders working to improve the lives of children and young people in the U.S. Today's session will feature Sam Larson and Jim Deering with Michigan State University. The conversation will focus on their report titled Strategies to Scale Up Social Programs. In the study that was commissioned by the Wallace Foundation, Larson, Deering, and Thomas Becker examined 45 diverse nonprofits and the scaling up choices they made in 3 areas: their partners, their approach to spreading their work, and their call on the balance between fidelity and flexibility. A link to the report was included in the reminder notes for today's session, and I will post it in the chat as well. A bit about our presenters. Karen Pittman is President and CEO of the Forum for Youth Investment and a respected sociologist and leader in youth development. Prior to co-founding the Forum in 1998, she launched adolescent pregnancy prevention initiatives at the Children's Defense Fund, started the Center for Youth Development and Policy Research, and served as Senior Vice President at the International Youth Foundation. Sam Larson is Assistant Dean in the College of Education at Michigan State University. Larson's scholarly interests include systems change, academic entrepreneurialism, and program implementation and scaling within and across nonprofits and higher education organizations. She also leads Diffusion Associates, a network of professionals who work alongside program and policy leaders to bring social innovation to scale. Jim Deering is Brant Endowed Professor and Chairperson of the Department of Communication at Michigan State University. Deering studies the diffusion of innovations, including the adoption, implementation, and sustained use of evidence-based practices and programs. His research teams currently focus on improving nursing home care, helping environmental health officials serve communities, studying the scale up in the U.S. of health and healthcare innovations from abroad, and designing for the further diffusion of a promising telehealth innovation. A few logistical notes for today's session. There are only a handful of slides. We will be accepting questions and comments via the chat feature on today's session, which is available at the top of your screen. We also invite you, if you're a tweeter, to tweet using the hashtag ReadyYouth. That's ReadyYouth. So please engage in the conversation and send your questions as they come up, and we'll pause a few times during today's session for those questions. Today's session is being recorded. Early next week, it will be sent to everyone who registered and posted to the ReadyBy21.org website, along with any additional resources that are mentioned. Now it's my pleasure to turn it over to Karen.
Thanks, Ian. And welcome, Sam and Jim. It's going to be a delightful conversation, I'm sure. And I just want to get us kicked off by asking you all to sort of tee us up with 2 things. One, what do we exactly mean, or what do you mean by scale and scaling up? And are we at a point where we can say there's a science to scaling up? Where are we in this sort of journey towards helping programs scale?
Jim, why don't you take that question?
Sure. Karen, very good questions. I think we do have a social science of scale up, starting with your last question, in part because this topical area builds on prior academic research and also practical experience of a lot of people like yourself, and much of that experience does get codified. So more specifically, there's a body of literature that I try to stay abreast with and contribute to called The Diffusion of Innovations, partly sociological, partly psychological, a little bit of political science, and with a dash of organizational and management expertise thrown in. And this isn't old literature. It goes back to the 1890s, about 1894, for theories and hypotheses, and then empirical data started to be collected in various topical areas: agriculture, education, even pharmaceuticals in the 1940s, 1950s, and into the 1960s. And so some of the ideas around scale up are pretty well established. We have tens of thousands of publications and empirical studies. Now, that's not all to say that we know everything. You might think if you have tens of thousands of studies that you know everything. Of course, that's not the case, because society is always changing, new technologies are created, and we have new challenges to solve. So there are some things we know. We think that we have a social science of scaling up or diffusing and spreading innovations, some codified knowledge to this effect. Sam, what would you add to that?
Well, I think I would go back to, I'll go back to the first question, which is, what we meant by scale up. And to say that, when we were looking at issues of scale, we were looking at issues in increase in quantity, the number of times that an innovation or a program is offered, or an increase in the number of recipients or users of that program. But we were also looking at issues of the maintenance of quality. So you can scale something up, but it gets diluted. It doesn't have the same effect. And we were less interested in situations like that. For scale up, we were looking at both expanding the number of recipients or beneficiaries of a program, and that impact was similar to an impact before the program was being scaled up.
I think that definition will serve us well through the rest of this discussion, and I think with most of the folks on the phone, because that's often seen as the dilemma. Even as you were mentioning, Jim, and going from the standard place where you've had a program or a curriculum or an intervention that was very intentionally developed and researched and demonstrated to have an impact, and now we think it's ready to scale, and that whole question of how do you do that in a way that you can actually assume that you're going to get, if not exactly the same impact, something that approximates the impact that you got in the experimental session. So what did you learn about the various ways that folks who have created what we think are effective programs, or what they have demonstrated are effective programs, what are their choices when they come to thinking about how to actually get that out to more young people?
This is another really good question, and I know Sam will have something to say about this as well. But Karen, you're initially making me remember the distinction that we learned in our interviews, especially with leaders of these 45 different social programs that we'd studied, all of which were effective programs, all of which had scaled up to some degree in the United States. And the distinction that you're making me think of is that some of these had a research basis, others had a practice basis. And after a while, after a program's been around for 4 or 5 or 10 or 15 years, that distinction can blur, because the practitioners who start a program because they feel the need for that kind of a program, they eventually run into obstacles and challenges, for example, with funding, right? They can't necessarily get funding without some evidence of effectiveness and societal benefit. And so they end up adding research or evaluation components to what they're doing. And that kind of an approach, starting with practice, identification of a need, and then moving to an appreciation for data, all the while scaling up the practice itself, that certainly can work. We saw a lot of cases like that. And then we also saw what you might think of as more deliberate approaches to scale up that began as research studies. And so you had researchers involved, you had academicians involved, and one of the topics, one of the challenges for researchers is that so many of them are in a particular mindset, in a particular normative situation at a college, at a university, at a think tank maybe, where they see their role as creating interventions and just testing them, not scaling, not diffusing. And so having an academic make that change or that jump or develop that spin-off organization outside of a college or university, that's a real trick. Most academics are not trained to do that. They don't know how to do it, and they're not rewarded for it. Sam?
I think the question about how to scale and maintain fidelity was probably the core issue that we were examining. And it's a very complicated response to your question in terms of if what we're interested in is understanding how we can assure the similar impacts. And what I would say is that, to build off of what Jim said, there was a lot of practice and a lot of research that went into the development of these programs, and eventually all programs, whether research or practice-based, had to engage in some kind of a test, an evaluation, a quasi-experimental design. It ranged in terms of the style and the method of testing the impact. But they all eventually reach a stage like that, at least the ones that we chose, right? That there was an evidence that they were having an impact. The question then becomes, when you decide to scale something, how do you know that you're having that impact? And so, you know, one of the things that I found very interesting, and it's not very surprising, is that if fidelity is the #1 concern that a program developer has, that my program needs to be offered in a very specific way, I may choose to do a slow and steady growth model where I really branch out. I expand my capacity, or my organization's capacity, to be able to provide this intervention or this program to more people, and it allows me maximum control. And that allows me to be able to focus on issues of fidelity and keep fidelity at the center of what I'm interested in. And we certainly found programs like that. But then we also found programs that they decided that fidelity was, of course, important, but they really wanted to increase implementation and use quickly or more broadly. And so they would start to make decisions about part of my program can be adapted to deal with the contextual situations that people find themselves in. And that you start to see people making intentional decisions to say, this is core, this can be adapted, this cannot be adapted. And I think that one of the things that we found along many of the programs is a continuous feedback loop to check on effectiveness, to know that the program is having the kind of intended impacts. But there also reaches a point where, at least for some of the providers of programs, that they're confident enough in the effect of their programs, the impact of their programs, that they no longer feel that that's where their focus needs to be. They begin to focus on other things, and there's enough experience from the system and watching this done that they don't need to focus on that anymore. And that's a very interesting point for a certain kind of an organization to get to.
Those are really interesting and complicated ideas that you just put out there. And I think, let me see if I can play a couple of them back and then ask you to give us some examples. So the first thing I want to emphasize is your point that for the 45 programs that you selected, and I'm going to ask you to tell us a little bit more about how you picked them, because I think even the way you went about finding them was interesting. You were looking at programs that, from whichever place they started, they either started as a researcher specifically designing an intervention that was in a very particular context, or they started as a practitioner that over time had been sort of working and growing a certain set of practices, that by the time you got to them, they basically, whichever door they'd come in, they'd ended up in both places. The research had already figured out how to get that out of that sort of specific research setting and do it a couple of times, so that you had that sort of preliminary scaling to see if it actually was going to work in the real world, or the practitioners had actually gotten to the point that in order to continue to grow and fund their programs, they had to do some kind of study. So by the time you selected them, they had achieved both some level of replication or scale, and they also had an evidence base behind them. So that got you your criteria for selecting them. Where did you go from there? How did you get to these 45 that you selected?
You know, that's only a fun question to ask in retrospect and to answer in retrospect, because it was extremely difficult, actually, to find these programs. Those on the call, or those who might listen to this webinar, might think I see them everywhere. But we weren't in a position where we were necessarily seeing them everywhere. And because we had criteria such as, you know, we wanted evidence of scale, we wanted to know that evidence of fidelity, or not of fidelity, but of impact, was still there. And we were also looking for people it was clear that there were some partners involved in this, because this was another thing that we were interested in, was looking at partnerships. We also wanted to know that when they scaled, that they used the style of one of the 3 pathways to scale. And there are other ways to get to scale, but we focused on the 3 that we thought were most prevalent in our search. But we started off by doing expert interviews. So we worked with different people around the country, at several different foundations, and people that we knew were interested in issues of scale. And we asked them to nominate programs. We also did a lot of reviewing through a variety of different databases to be able to read about programs. And so we had well over 100 programs that we decided we wanted to review in greater detail. And so then we started to look at all of these programs in greater detail to get a sense from the extant literature. What could we tell about these programs that would get us closer to being able to identify a group that we thought would be really illustrative of what does scale look like, what are the challenges that they face. But there is no data set out there that says, hey, folks, here are all the social programs out there that have an evidence basis and have scaled successfully. And so, you know, when you don't have that kind of information readily available, you end up piecing it together from lots of different sources, and that's eventually what we did.
One of the other things, Karen, that we had noted of publications about social programs that had scaled up in youth development or education or health in the U.S. was that what we were reading, the things that were written about those programs were kind of one-offs, or maybe they were about 2 or 3 programs, and they would be written as narrative descriptions, which was helpful to us, but we thought that there was an opportunity to do a different kind of study with a larger N, a larger number of programs that had scaled up, because we believed that there would be a larger number that had both been effective and then achieved some degree of scale up in the country. And so the study took on a characteristic of what we would call a comparative case study analysis, and in particular, a process of pattern matching. So when you get a lot of units of something, in this case social programs, you start looking for commonalities in those programs that you're assessing. You're trying to match up patterns and then explain those commonalities that you believe you're seeing through archival records in our case, and then also interviews. So Sam's right, it was laborious, and it's nice to have it behind us.
Well, you ended up with quite an interesting list, and I wonder if for the folks on the phone, if you could give us an example of one of the organizations that you ended up studying, and sort of how you would describe it through this case study model.
Oh, well, that's, you know, we'll probably talk about the ones that we know best, which is not necessarily to say that they're the best ones, because they were all pretty successful. I actually think, Karen, it would help if we talked about more than one. Could we do that? Because the compare and contrast.
Yeah, absolutely. Go ahead and do a couple and do a compare and contrast. That would be great.
Okay, so Jim, I'm thinking about campus kitchens and climate matters as 2 that might be fun to share with folks. And so I'll describe what I can recall now of the campus kitchens, but the campus kitchens model started in Washington, D.C. as an offshoot of a food bank, if you will. And the idea was that on college campuses, we have many cafeterias sometimes. And there's a lot of food waste associated with those cafeterias. And that we have students on campuses who are interested in impacting their local communities. And food security is a concern for many, many communities. So campus kitchens started off with just a couple of universities where they started to develop relationships, and they said, you know, we can keep our home office small if I can work with the resources that universities already have. And those resources include students, and they include food that's available at these institutions. And we're going to grow, and we're going to scale out this program by working with universities. And so they've kept their home office small. And what they did with campus kitchens as they said that, there are a set of criteria that are important for this program for students to learn and to begin to address these issues, so that we're addressing food security in the community, but we're raising awareness for students about the human condition and the social conditions more broadly too. And so they did a lot of online training where students would have to submit a proposal to be considered to be a campus kitchen. And the process of actually making the submission really built up the readiness of a campus to be able to successfully implement a campus kitchens model. So they relied a lot on technology. They relied a lot on volunteers to be able to do this, and they worked with the Sodexo Foundation as one of many foundations they worked with. They also worked with AARP, as I recall. But Sodexo is a food organization, and one of the things they do is they provide food on college campuses, so this is a particularly good partner for them to have. Because of the model that they used of keeping the home office, if you will, small, they relied a lot on social media. They did a lot of their training via webinars and web-based things to reduce costs and make it available anytime, anywhere for students, which is a model that really works with a student group in particular. They were able to spread this out fairly rapidly to a number of different campuses across the country to be able to find ways to address food security that were meaningful to local communities. So no two universities have the exact same program, but they all meet the same guiding principles. And then they have feedback loops built into the process so that they can stay abreast of what's happening with these organizations, and they create very fun and engaging ways to compete for funding and to tell your story. Very, very social media savvy group along those lines. So that's their strategy was kind of really like an affiliate model. We are going to have a small home base. We'll use an affiliate structure, and that's how we're going to grow. So that was one approach to growth from one organization. And Jim, if you wanted to talk about Climate Matters, it's a very different approach.
Sam, before I do that, let me just make one additional comment, which I was impressed with concerning campus kitchens, and that is they managed to solve the personnel problem, which is always a big hurdle when you're trying to scale a program. And what I mean is that in their case, they realized the leadership, the 12 people who work in campus kitchens nationally back in DC, in the back office of DC Central Kitchen, those leaders recognized that students on campuses could serve as volunteers. And those volunteers could, in fact, be the personnel, the staff, who would play the big manpower role at each of the campus-based kitchens that would be established throughout the United States. And so that solves a huge problem for them. They have the people who are preparing the food, packaging the food, delivering the food. These are volunteers. So you eliminate the cost of paid staff in that way. The other smart thing they did, and it's the same point about volunteers, Sam mentioned the partnership with Sodexo Corporation and the Sodexo Foundation. And so Campus Kitchen's leadership nationally was purposefully going to those campuses where Sodexo has operations. They don't have operations at all campuses, of course, but they went to those campuses where Sodexo has a presence, a corporate presence. And Sodexo Corporation requires a small number of hours, I believe it was 4 hours per month, of community service of its employees on its campuses where it has operations. That's really important. What that meant is that Sodexo employees could volunteer those 4 hours by helping the students understand how to work in a kitchen, an industrial kitchen, a working kitchen. And so they solved the problem for Sodexo employees with this volunteer opportunity. They solved the manpower problem with having students lead the teams and the outreach efforts in their communities. And that was a big reason, at least in my mind, why Campus Kitchens was able to successfully scale. One other thing about Campus Kitchens I'll mention is that they have, as I mentioned, a national leadership team, 12 people at the time we interviewed them. That's very few by my way of thinking. That's a staff of full-time 12 nationally. But they are bottom heavy. They have hundreds and hundreds, thousands, I'm sure now, of, as I said, volunteers, students, community volunteers, Sodexo employees, and others who actually do the work of collecting food, preparing food, packaging the food, delivering the food to needy people in their communities. So we saw this again and again and again with some of the successful programs we studied. They have figured out ways to have a national infrastructure, yet it's extremely thin or lean. They're bottom heavy, even though they're nationally organized. Let's see, Sam, you wanted to also briefly discuss climate matters.
And Jim,
Yep.
I just want there's a comment too about the distinction between scale out and scale up. So when we get done talking about climate matters, that might be something that we'd want to spend a little bit of time talking about.
Yeah, I think that.
Yeah, before you shift over to climate matters, just so we can have some comparisons, you said the Campus Kitchens project is one of several that you all looked at that use this you sort of called it bottom heavy model of having a tight group of staff at the national level and then finding innovative ways to actually sort of scale out quickly. In this case, by using campus volunteers. What other programs that our listeners might know would fall into that category of using that, not only using sort of an affiliate model, but an affiliate model that's really volunteer based? Does anybody else fall into that kind of category?
Boy, I think that one of them we studied, it's an environmental education and participation program called Earth Force. The Earth Force process is the model they use. I think that it's fair to say they fit that same sort of model. And they're a case, Karen, of a social program that began with a different kind of structure. It was a much more top-heavy structure, meaning that they had a larger centralized staff, and they also had established regional offices to support the work that was going to happen in different regions of the country. But then, at a certain point in time, leadership within Earth Force decided that this was too expensive. They had all these paid staff. They needed to rid themselves of some of that expense so that they could invest more time at the local level. And so they kind of flipped their organizational model and, from my understanding, now have much more of a lean leadership number of people in a national sense, and they have a greater volunteer presence. They're in schools. These are K-12 schools, organizing students to engage in environmental projects in their communities. So I think that one fits the bill.
Okay. And I think what I'd like us to do is, we'll go ahead and go to the second slide so we know that folks, as you're talking, you're describing programs and organizations that have selected different sort of scale-up pathways. So the Campus Kitchens you described, Jim, as sort of an affiliate model, using a particular strategy to really sort of move out very quickly. You wanted to talk about climate matters. Is that a different? Do they pick a different pathway for a scale?
Yes, the climate matters is kind of is an example of a distribution network.
Okay.
So with climate matters, this was the idea of a social scientist at George Mason University named Ed Maybach. And Ed had the idea that it must be possible to more efficiently disseminate accurate knowledge about climate science to the U.S. population. So Ed has a background in social marketing. He's a health marketing expert, long tenure with the U.S. government in different agencies. And so he understands dissemination. He understands marketing logic very well. And his key insight, I think, in creating this social program of Climate Matters was that people in public opinion polls have told surveyors that they consider weather forecasters to be very credible sources of information about, guess what? Weather. And so Ed sought to piggyback on that perception of credible sources by essentially providing content in prepackaged ways to weather forecasters at TV stations, local TV stations. They began with one site in South Carolina, one TV weather forecaster, and he's a meteorologist. And so what this meant is that they provided him with camera-ready content that he could use in his broadcasts to try to explain climate science more accurately to his viewership. The program was funded by the National Science Foundation initially in this testing phase, and they went through and received, I believe, a second NSF grant before then attracting more stable funding partners with NASA and with NOAA and the National Association of Meteorologists. I would say now that there are, I'm not sure how many, Sam, but there are certainly hundreds, I believe several hundred meteorologists who function as TV weather forecasters who regularly use Climate Matters prepackaged information. The information is also, it's not completely prepackaged, it's specific to the locality of the weather forecasters. So it's kind of like customized yet camera-ready content for the weather forecasters to consider using to augment what they're going to talk about on screen. Sam?
Yeah, and what's interesting is, you know, Ed has done this. He recognized early on that what he needed to do was to find the different points of distribution and expertise, content knowledge, graphic ability, and then the network that actually knit people together, such as people in the weather, climatologists together, and to be able to spread this educational function more broadly. And so he's really put together and worked with the extant network that already exists through associations and through relationships within those associations to be able to scale Climate Matters. And so he had a goal of 300 within 3 years of starting this, and he was at 300 by the end of year one because he was able to actually use a pull through a very diverse system to get people interested in this. And his nudge was a slight nudge, a smaller nudge than, because he was actually using this, the power of the network to be able to pull it through.
Okay. So I think we've gotten an example of, as you said, sort of a distribution network through Climate Matters, an affiliate network. And just looking at your longer report in that sort of affiliate network space, since a lot of the folks on the phone are sort of in the youth development space, you included organizations like Citizen Schools, Communities That Care, Kaboom, the Life Skills Training Program, and Teen Outreach as others that you have included in the report. Maybe you didn't look at them as fully, but that met that sort of affiliate pathways model. And then the last one to talk about, and perhaps I think in the report, Kaboom was your example of branching pathways, which I'm assuming is the slower model, as you said, where you've got more control over doing it yourself. Can you just say a couple of quick things about the pros and cons of taking that branching approach?
Sure, and you know, I want to say one thing about Kaboom is that, I mean, that is a long-time complex program, and it has used multiple methods to be able to scale up. And we captured one particular point in time when we were looking at Kaboom. But I'm sorry, so Karen, what was your question then again?
Oh, just to make sure that folks have an example, since we've got the pathways slide up, that they understood examples of both the affiliate, the distribution network, and the branching. And Kaboom is one that you sort of, I think, described as at least starting with the, no, it was Playworks, I'm sorry, that you described in starting with the branching model. Maybe just a couple of words about why Playworks selected that sort of slower model, and then we can go to the interesting point that you just made, that over time organizations may take multiple strategies for doing this, depending on where they are in that scale process. But can you talk a little bit about Playworks as an example?
Sure. No, that's when we went out to Oakland, California, and interviewed Jill Valet, the founder and CEO of Playworks, and interviewed her staff there. They told us, they recounted their own organizational history. And so this is a case of an organization that's founded explicitly for that one particular program. Jill had been listening to principals complain to her. They're looking out the window. She's sitting in a principal's office at a urban elementary school, and the principal's complaining, seeing that certain kids are getting in trouble on the playground during recess. Other kids are standing by themselves, not being involved in play activities, feeling socially isolated. And so she decides she's going to create a social program to ensure that all kids get to benefit from play during recess and lunch hour. And she works initially with one school. And I think that in answer really to your question, Karen, they started out in a branching pathway because that's what they knew how to do. And Jill and her staff made the assumption that there had to be a full-time staff person, well-trained, that they would provide, which was an AmeriCorps volunteer in their original branching model, who could be on site and develop play activities that would reflect the curricular lessons in the different classes that the kids were having at the time. And so that's how Playworks started out. Eventually, this branching approach to spread, while it was effective for them, it also wasn't achieving their scale-up objectives in a rapid way. And so she decided they would create a couple other types, a couple other versions of Playworks. And this is one of the key lessons. Sam kind of hinted at this a few moments ago, but this is part of the lesson that we learned here, was that you see modulation across different pathways to scale up by social entrepreneurs like Jill Valet for Playworks. And what I mean is that they start through one pathway. If they become dissatisfied, or if they see an opportunity to reach other kinds of schools, in this case through a different pathway, they'll do that. So she had a costly and very intensive version of Playworks as version 1. She created 2 more versions because she began to realize not every school needs a full-time AmeriCorps volunteer on staff. They just don't need it. Some of them have higher capacity and can do things themselves, or almost all themselves. So they created Playworks Lite, and they created a fully online version of Playworks. Those are much lower cost for higher capacity schools to consider adopting.
I think that's a great model, and I think that's something that a lot of folks listening will resonate with. And I know that in the paper you have a chart, which we don't have up on a slide, but just to emphasize the fact that both this kind of decision making happens over a pretty long period of time, and that those decisions vary. And I think when you were beginning, you talked about the fact that at some point, either programs go to this kind of let's adapt. We started with the reinvention model, where we were very deliberately going out and not only being the staff, or extensively training the staff that are going to do the work, to let's come to these lighter versions where we hope that people have enough capacity to be able to do some of this themselves. And so that's your reinvention versus adaptation when you get to, or adaptation when you get to the Fidelity space. But I think the other thing that has come up as we've talked to folks, and I think even a couple of questions have come in, are just sort of, how long does this take, and what, as you were talking to folks about when they make these different decisions to move, what seem to be some of the criteria? You mentioned, again, for Playworks, they clearly felt like they weren't getting to scale fast enough, so they had to step back and think about a different model. Were there other variables that sort of factored in to trigger when an organization shifted from one model to another, whether it's a pathway model or they shifted from sort of a strict reinvention to an adaptation model. Money, opportunities, are other things factoring into when that shift happens?
I think it's yes to all of the above. One of the things that was really important, I think, are the role that foundations can play in this conversation. So, you know, we had, if you look at when we were looking at the programs that were in a distribution network in particular, you really did see a presence of foundations encouraging nonprofits or the creators of these programs to think differently about how they were going about doing spread and providing both expertise in terms of how can you do this, what are things that you might need capacities that you might need to be able to build. They were also introducing people to partners who could potentially help them at implementation distribution partners who could actually help them do something like this, providing initial funding along these lines too. So foundations play a role in helping people to think about how do I make the jump, how do I make a leap to somewhere else. I also think, and then Jim will chime in here, but I think technology plays a role in this too. A number of the programs, you know, have been around for a long time, and technology, you know, has been around. Email's been around for a long time too, but it's easier to get more things out there, not always with great impact, but technology plays a role too. And then I guess the last thing I'll say along these lines, and then turn it over to Jim, is that, you know, a lot of this though is really influenced by the person leading the organization. And the leaders of organizations, some of them choose to make a decision to have a slow, intentional growth strategy so that more people will be exposed to their programs. They may choose not to make many modifications to that program, and slow and steady does it, and they've been highly successful. They're not interested in using a distribution model. And then there are other situations like somebody at a university, almost if they're developing a program, they almost have no choice but to use something like an affiliate or a distribution model because the nature of the organization doesn't allow them to actually build up and to begin to offer programs like this. So those are some of the factors. Jim, what are some other factors that you think influence a decision about which pathway or how to reinvent or adapt?
It's a really good question. Sam, I think we did see some progression in some cases from branching to either affiliate or distribution network pathways. So we termed in part use of a branching pathway to be an onboarding process for many social entrepreneurs. It became what they tried first. And so if they were hesitant, if they were really focused on Fidelity, if they wanted to make sure that a particular intervention was going to be implemented just in the way it was designed and carried out initially, they opted for control, and that means a branching pathway. And in many cases, that's very appropriate. But the fellow we mentioned, Ed Maybach at George Mason, that's a very unusual approach for an academician especially to take. Now, he took that, again, I think, because he was trained in marketing and social marketing. And so he felt confident that the Fidelity question for him was the preparation of the semi-customized information by an affiliate organization called Climate Central, that they knew climate science and they would do a valid job of representing information in what they created for meteorologists. But the question of, well, how does the meteorologist then use that information or talk about it or portray it on screen with their audience? That's an entirely different question. And I think because Ed was a marketing scientist, he was able to essentially let go of that degree of control and assume that meteorologists would treat the information in a valid way. But for many innovation developers, that's a bridge too far.
Okay. I think we've got a couple of questions that are coming in. Some of them are pretty specific. I just took a quick look at the list that you have, and someone was asking whether any of the programs that you looked at or that you know of have scaled up that are focused on sort of a counseling or mentoring model. I just took a quick look at the list of 45. I don't see any that are obvious, but as you were doing your broader scan, did any of them that you looked at have counseling or mentoring as their focus?
Well, actually, there was one called Clinical Chapters, and that initiative was looking at, it was a network of therapists working with foster children. And so they used a model where they were tapping into professional associations to identify therapists who would agree to take on pro bono work, and that was one of their strategies for being able to meet the needs of foster children. Some of the programs that were around getting students ready for college, like College Possible, there was a fair amount of mentoring involved in those programs as well. So, and those programs, I'm sorry, Jim, you were going to say something?
No, I'm just agreeing. College Possible, Posse Scholars, that type of program.
Yeah, they actually have a fair amount of mentoring and certain kinds of maybe career counseling, and then maybe also some personal counseling too, as components of the programs that they have.
Mm-hmm.
And again,
go ahead.
No, no, please, Karen.
Yeah, no, I was just going to say I would guess because that person goes on to sort of ask about ways to reduce administrative costs. I would guess that programs that have that kind of like mentoring approach, since they are often relying on volunteers, that scale allows them to reduce some of those administrative costs. If they can come up with an effective strategy for replicating or getting people to adapt.
Yes, and so I think that they're looking for volunteers. They're also working with some kind of an association or a network. These are people who belong to a professional group, who identify themselves. They have it's easier then for them to identify who might be potential partners for me, because there's some kind of a professional affiliation to be able to do that.
One quick thing, and then I want us to go on to talk a little bit about the partnership one and come back to a point that you made. But earlier you mentioned the distinction between scale up and scale out. Can you say a little bit more about that?
Well, I think that the person who posted that, I think that this was an interesting tension for us. So, what is the distinction between a scale out and a scale up? And so if what I'm doing is simply taking my exact same program and providing it in more venues, is that a form of scale out? And it could be defined as a form of scale out. And scaling up then might suggest something more like a PlayWorks model, where I'm developing different kinds of models to be able to address a broader group. Or is scale out really about developing complementary programs, so that maybe I start off focused on issues around playgrounds, but that eventually becomes I incorporate bullying and playgrounds and a variety of other actions like that too. And, you know, we probably could have wrestled more with that in making that distinction. And I would say that some of our programs have components of scale out, and some have components of scale up to them.
Yeah, and so we see a distinction, and maybe this is what the commenter means. I don't use that particular language, that distinction, but we did look at programs. All of these programs increased the number of sites at which they were offered. And so you might call that adoption, right? Community level adoption, organizational adoption. So it's the decision to try a new program in a new place. And then you can also, of course, try to measure, well, how much of that new thing are they doing at that site? Many people will describe that latter question as scale up. So, for example, in the case of campus kitchens, it's one thing to establish a new campus kitchen at Northwestern University. It might provide 100,000 pounds of food in its first year. Well, if you move to providing 300,000 pounds of food in your second year, have you scaled up? Many people would say that's an accurate description of that term.
Right. So variations in how we use scale up and scale out. One of the terms that we use here at the forum, because we work with lots of local communities, is a complementary term that we use, which is saturate. So the scale conversation often is one about going from local to regional or local to national. You're sort of hopping over the community. So scale out might be, first I'm in 5 neighborhoods and then I'm in 15 neighborhoods. I'm doing more, or I'm just serving more young people in the same place. And for us, we tend to use the word saturate, or whether that's one program or a network of programs, are we actually getting more of whatever the population is we're focused on, more young people served through some kind of model, versus the program then saying, let's go do it in Richmond, or let's go do it in Chicago. Let's try to find other ways to do it. So I think both of those are important, and you know, the language around them doesn't have to be perfect. I know as we're sort of hitting the 10-minute mark, I want to spend a little time on partnerships. So I'm going to ask Ian to go to our your last slide about strategies for scaling up programs focused on the partners. As you were mentioning, folks often getting to partners, and speaking to one of the questions that was also asked about sort of when and how does funding, external funding, come into play. You mentioned that sometimes folks jumping into that distribution model and looking for partners is when a funder comes along and suggests that this is a natural thing to do. As you were looking at the folks that had the programs that had used the distribution model, did you find a difference between programs that decided that they needed to find a distribution partner and look for them themselves, versus programs in which, for lack of a better word, there was sort of a forced marriage?
That's a really good question. I wish we would have studied it. I don't think we did. Sam, did we study this?
Well, I think that there was Power Scholars is an example of external groups coming together and suggesting that there might be a match. So they were playing a bit of a matchmaking role, and I think that you know, some of the funders that are involved in efforts to promote scale or saturation, they're in conversations with lots of different groups of people, and they are drawing connections, and they see potential opportunities. And so there is absolutely some intentional effort by some foundations to say, let's try this and see how this can work. Can I work with a program created in Boston and have a conversation with the YMCA or Boys and Girls Club of America or somewhere else to say, can we make this work and meet the mission of your organization and the interest of the populations that you want to affect and the way you want to affect them using this program right here? And so I think you do find foundations playing that role. And in the distribution networks, more so than in the other pathways, those kinds of connections seem to be more important. That partnerships were brokered, or you were relying upon a larger network of professionals that you could draw on.
Yeah, Karen, one of the findings I remember well, because it impressed us in this work, was that these social entrepreneurs, many of those we interviewed, not all of them, but a number of them we interviewed, wanted more exposure to other people like themselves. They felt disconnected. They wanted advice and technical assistance. They didn't feel like they had answers to things that they had to figure out for themselves earlier on. So I think maybe it's different for people who take a distribution network pathway approach, or maybe some of these social entrepreneurs just end up in that pathway as a final solution for reaching more people at a rapid rate. But many of these social entrepreneurs gave us the impression that a network did not exist of people like them. They wish one did, and they would like to share best practices more readily so that they wouldn't have to reinvent the wheel themselves.
That's interesting that was a motivation for going to look for a network. I hadn't thought of it that way, but that makes a lot of sense. As we're coming into the last couple minutes of the call, and this has really been a very fascinating call, I'm hoping folks that are listening in have decided that they need to go download the paper and read it, because the examples that you have in the paper are obviously more than we could talk about in an hour. But as we look at your last slide on lessons learned, you've spent a huge amount of time studying these 45 programs. How would you sum up where we are in terms of understanding strategies to scale up social programs?
I think that we're at a pretty early stage for understanding strategies for scaling up social programs. It is an awfully complex process for people to be engaged in. We were talking to some people who had made a scale-up decision years before, and we were relying upon them for recollection. And even then, we were limited in the number of things that we could study. But I would say that we're in early stages of really trying to understand this, and that there's a lot more research that needs to be done in terms of understanding scale-up and being able to help people work through it. That said, there did seem to be, some common themes that pop up and things that we know that people need to be focused on. So a lot to do, but we've also learned, not just us, but others who have been studying this have learned as well.
Karen, we saw some programs that are quite complex in the number of components that they have, the number of recommended activities or required activities that staff are instructed to engage clients with. And one of the keys to scaling from our perspective coming out of this little study was that simplicity is not necessarily a bad thing, and that simplicity, taking a complex program, which also often means an expensive program, and finding ways to make it simpler, hopefully more robust, and as a consequence almost less costly in itself. Those are disruptive conditions that allow you to reach disadvantaged populations, more people, and also to work through people who are not necessarily very highly trained to deliver a program. So, the well-known case, and it's in this study, but it's been publicized elsewhere, of the diabetes prevention program that the YMCA of the USA learned about and eventually spread throughout much of their network of 2,700 YMCAs in the United States, is an excellent case of a complex and expensive program that was made less complex and especially less expensive, partly by moving from a one-on-one counseling model to a group-based counseling model, and partly by taking a program that had been vested in medically trained personnel and training non-medical personnel to deliver the same program. It's not the only program we studied like this, but it's a rather general finding that sometimes complex and expensive programs can be changed to be simpler and to be less expensive and sometimes more robust. That is, they'll still achieve their objectives across more sites than as originally tested. But to me, that's one of the key lessons of the study.
I think that's a wonderful place to end, and a very important place as we're looking to not only think about scale, but think about questions of equity and access. This has been a terrific conversation. We could go on, but we've hit the 3 o'clock hour. So I'm going to thank you both for joining us and having this great conversation, and turn it back to Ian for final closing comments.
Well, thank you everyone for joining us today, and thank you very much to Jim, Sam, and Karen, for your time today and your thoughtful remarks, and we will be sharing the recording early next week along with another link to the paper. So again, thank you very much and have a good afternoon.